Hello, everybody, and welcome to this another in our series of important conversations about the challenges facing New York City today. Sorry about the background noise here, working from home. That should hopefully die down in a moment. I'm Mark Levine, City Council member from Northern Manhattan and chair of the City Council's Health Committee. And our topic today is the city's vaccination plan. We have a lot to talk about, but I want to acknowledge that we're all dealing with some pretty intense emotions after the horror that occurred yesterday, an attempted coup in our nation's capital, a Capitol building which had not been breached even during the Civil War, loss of life, an attempted disruption of the democratic transition of power, very directly and clearly stoked by the sitting president. We need accountability for the insurrectionists. Every one of them needs to be identified and held accountable by law enforcement. We need accountability for the countless political leaders, Republicans, who have aided and abetted the cancer that is the Trumpian movement. And perhaps most urgently, we need to deal with the imminent threat that is the ongoing presidency of Donald Trump. Every hour that he's in office, with access to the nuclear codes and the machinery of state, is a danger to this republic. And it's why that I believe the cabinet should invoke the 25th Amendment, and failing that, the Congress should move to impeach and remove him from office. Those are the stakes, extremely high. And to the extent this is something that you want to speak about in this hour, I welcome that. But we also have an ongoing pandemic that we can't afford to take one day off in fighting. And a vaccination program now, which is, we're about a month into it in New York City. And there are real challenges with the speed at this rollout, which we'll be talking about. And there's a lot we want everyone to understand about the vaccination that is currently available, who can access it and how. And so there are practical questions about what's available today and what the timeline looks like in the weeks and months ahead for all of us who so desperately want and need this vaccine. Usually in these conversations, we have an invited guest or two or three experts and leaders. We put this one together very quickly because of the urgency of the issue. And so we're taking this as an opportunity for me to chat directly with all of you, to take your questions and thoughts about this critical topic. And I look forward to doing that. You know, we always throw in a little bit of Spanish. So brevemente, yo soy Mark Levine, concejal del norte de Manhattan, presidente del Comité de Salud del Consejo Municipal. Bienvenidos a otra en esta serie de charlas acerca de los retos que estamos enfrentando en la ciudad de Nueva York. Hoy se trata de vacunación, cuál es el plan, quién está elegible y cómo es que uno se puede vacunar, qué es lo que está programado de aquí a varios meses. Hoy se trata de este tema. Por favor, hagan sus preguntas acá en el chat o a través de Facebook. But I invite you to put questions into the chat. Some of you might be following on Facebook, and we'll be monitoring that as well. We want to hear from you. But first, just a few big picture thoughts. We really have a two-front war right now. We have the fight to speed up vaccination, to get as many people vaccinated as possible, to get the right people vaccinated in the right priority. And there's a lot to talk about. That's really what we're focusing on in this hour. But we can't take our eye off the fact that COVID is circulating in New York City at an alarming rate, at an increasing rate. We're now averaging 5,000 new cases a day just in New York City. 5,000 new cases a day in New York City. We have this evening over 3,000 of our fellow New Yorkers hospitalized with COVID just in the 5 boroughs. And I'm sorry to say, even more painfully, that the pace of fatalities is continuing to increase. And we're seeing about 300, more like 350 at this point, fatalities every week just in New York City. And those numbers, as frightening as they are, don't yet probably reflect the post-holiday surge, certainly not the post-New Year's surge. And perhaps most alarmingly, they don't reflect the threat of the new variant, the UK variant, which, while not yet detected in New York City, we should assume is here. There's been one detection very close to New York, just 3 hours north of here in Sarasota and other places in America. And we are a large and connected city. And so we have to assume the variant is here. That only adds urgency to the need for us to accelerate vaccination and to double down on precautions to stop the spread. Vaccination is the way we're going to end this pandemic, but it's not a solution for the days and weeks ahead. It's going to take much longer to achieve the level of vaccination citywide that will slow this pandemic. So in the meantime, we still need to wash our hands and wear our mask, and even more importantly, limit our travel outside of home, especially those of you who are vulnerable or who have vulnerable people in your life you could potentially unwittingly contaminate. Back to vaccination. I'll just give a little bit on the big pictures. I see many great questions already coming in and I want to get to them. We have vaccinated far too few people in New York City. We're a month into this. We have to pick up the pace dramatically. I really believe we need to be vaccinating about 400,000 people or more every week. Of course, that's 2 doses. So that's doses 1 and 2. If we're going to get to herd immunity by the middle of 2021, that's our goal. In the last 7 days, we have vaccinated 52,000 people in New York City, and that includes a few thousand second doses. Well, at that pace, it would be years before we got to herd immunity. That's not acceptable. So we have to dramatically increase the pace of vaccination. And that requires us to go much bigger in more locations, not just in hospitals, but in community sites all over the city, at more hours, and with much more personnel engaged in this effort. I put in a bill that we're drafting now to try and force this by requiring that there be at least one 24/7 vaccination facility in every zip code of the city. And we have other bills that we're drafting that would require mobilization of volunteer efforts more than we're seeing now. The Medical Reserve Corps, broader volunteers. I know there's real will out there, desire to help amongst probably many of you, but many of the members of the public. We need to take this to a much, much more extensive level, and we'll be talking about that. But let me just quickly tell you about who's eligible now and who can get vaccinated now, and then we'll hop into your questions. At this point, we're in what's known as phase 1A, and that's focusing on people who work in healthcare, pretty broadly defined, including people who work in small doctor's offices, dentist offices, and not just medical staff, a receptionist in a small doctor's office, because they're obviously part of the healthcare system and potentially exposed, is eligible now for vaccination. There's also a parallel program for people who reside in and work in nursing homes. But the bulk of the effort and the bulk of the numbers in this phase are people in the healthcare industry and a few small related fields, people who work in funeral homes, et cetera. And if they work in hospitals, they've been able to get vaccinated there. But for people who are unaffiliated, and that's a lot of healthcare workers, including home healthcare workers, they're not in hospitals. And so the city is starting to open some community-based sites for them. This is what we need to accelerate dramatically. But there are a few sites which are now up and running, and more than possible now to make an appointment if you're one of the eligible workers for those sites, and perhaps we'll put the link in there. So I want to address one question which I've heard from many of you in the run-up to this, and I know that some of you are asking now, which is, well, what about other vulnerable groups? What about people who are elderly and are vulnerable, or people who are, they have underlying medical conditions that put them at high risk for COVID? Well, we know that's probably many of you, or you have loved ones, and that this is a source of great stress. And my goodness, what a difficult 10 or 11 months this has been for anyone who is in a high risk group. We're also stressed about this, but the added anxiety of any of you who are at higher risk. For those of you who are in those groups because of age or underlying conditions, you're not yet part of phase 1A, but I'm fighting for additional groups to be added to eligibility. I really think that people who are 75 years and over need to be immediately part of the vaccination program. And actually, the mayor, to his credit, has called for this as well. We need state rules to allow that, so we're fighting on that front. For people in broader categories of eligibility, because of maybe they're between the ages of 65 and I guess 74, or underlying conditions, the current plan is that they are not part of the vaccination schedule until about March or April. And I know that hearing that is probably extremely frustrated. I also believe that's too slow, and why I'm fighting hard to expand capacity in the ways that I talked about so that we can up that schedule. So I think I've given a long opening statement, and I'm anxious to get to your questions. So we have wonderful staff on here, and Wen, maybe I'll cue you if you could offer up some of the first questions that we have from our community participants.
Sure thing. Thank you, council member. Just to your kind of last point, for everyone who isn't in the 1A, Marcia asks, how will we know when it is our turn to get the vaccination if we're not in 1A, if we're in a different group?
Yes. Okay, this is a very important question. So first of all, the city has a dedicated text messaging system just for COVID, which many of you know. I'm going to look up right now because I want to give you the right number. And I am virtually certain that the way you access it is by texting the word COVID to the number 692-692. Yes, that is it. So some of you probably are already enrolled on this. This is a more specific text system beyond the general messages you probably get from the city of New York, like about a snowstorm or alternate side parking. Again, there's a dedicated text service the city has just for COVID, and maybe someone can put it in the chat, but I just mentioned it. I'll repeat it. Text the word COVID to 692-692. And every time the new eligibility group comes online, they'll text you. We need something more than that. We need a service that allows you to tell the city your specific circumstances, so the city can give you a specific alert based on your needs. And my colleague in the city council, Councilman Member Keith Powers, and I actually just wrote a letter to the mayor requesting this, and maybe someone on the team can text that out because I tweeted it out earlier. And it appears that the city is planning something of that nature. It's not yet online. It seems like the first step is going to be a system for people age 75 and older to enroll, but we need that so that people at least have the peace of mind that they're going to know the absolute millisecond that their group is eligible. So that's an excellent question, one we're fighting on, and that we'll keep you posted on. Go ahead, Wen.
Great. And we've got a couple of questions about the vaccinations themselves. There's actually two different main vaccinations. Melissa asked us, what's the kind of difference between the two, and how is it determined which one of the two you get?
Okay, great question, Melissa. So there's only been two vaccines which have gotten emergency use authorization from the FDA, one from Pfizer and one from Moderna. They're based on a very similar technology, which is RNA. And this is a pretty cutting edge technology, which is, it's pretty amazing because essentially it sends an email into your body that gives instructions on how to fight back against the virus, and then like a Snapchat message, it self-erases. So it doesn't mess with your genetic code, or there's no lingering impact other than the cells in your body being left with the knowledge, I guess you could say, of how to fight back. And this is a an exciting new technology, which, by the way, could offer solutions to vaccination for many other diseases. But we've gone bigger than ever on COVID. So again, the two authorized from Pfizer and Moderna both use Moderna. So they're pretty similar. One difference is that the recommendation for Pfizer is a second dose in 28 days. And another recommendation is that a second dose, for Moderna, the recommendation is 28 days. So that's a minor variation. But there's been no documented significant difference in side effect or effectiveness. They're both deemed to be highly effective with very, very, very low incidence of side effects. There's a big logistical difference in how cold each of them needs to be kept while stored. And for Pfizer, believe it or not, it's minus 80 Celsius, which is a very, very big challenge. And you can only do it with highly specialized freezers, ultra cold freezers. Moderna just needs a little bit colder than freezing. And so that's an easier challenge that the kind of refrigerators that are easy to buy can handle. And so that's going to be easier for broader rollout outside of kind of sophisticated facilities like a hospital or a Department of Health clinic, for example. So I think ultimately, yes, you can choose the vaccine, and in theory, you could right now by calling an individual provider and asking which one they are administering. There are some community clinics known in the lingo as FQHCs, federally qualified health centers, which are now administering the vaccine. Ryan Health is one here in Manhattan that's well known. I know for sure they're doing it at the Chelsea Clinton facility on 46th Street. And yet you have to really call them or email them to find out which vaccine they're using if you have a specific preference. More vaccines are coming. Johnson & Johnson has a vaccine that hasn't been approved yet, but we hope will be soon. That's not an RNA technology, but also shows great promise. The more that are out there, the better. It means we can get it to more people in more places with more options, and that's a great thing. So please, Lynn.
Great. Now that we got those two settled, we are getting a couple of questions, Mark, about what these phases, what are the phases, and what, when you mentioned phase 1A and B, what does that mean? Could you give us just a brief rundown of the phases and what they are and what they mean?
Absolutely. So, look, the whole idea is we have to prioritize to people who are high risk, or to people who, because of the work they do, are exposed and are critical workers. So healthcare obviously meets all those requirements, and they're first up in what is known as 1A, phase 1A, and there's others in that too. And then next up is phase 1B, which I'll explain. Then phase 1C is the third kind of specialized phase, and then we get to the general population. So a little bit more on what's in each of these phases and the timing. Again, we're talking about phase 1A, 1B, 1C, and then we go, I guess there's also a phase 2 and more broadly. So, so phase 1A, which we're in right now, is people who work in healthcare, very broadly defined, people who reside in and work in nursing homes, and a few other very specialized niches, such as people who work in the funeral home industry, for example. The next phase, which is 1B, will include people who are 75 and older. And can you just hold on, folks? I'm just going to ask for a little bit of quiet here in the house. Sorry. Thank you. So phase 1B is people who are 75 and older, and a broader collection of essential workers. Now, we don't know yet who is in that group. And there's lots of questions about who are going to be considered essential workers for phase 1B, a phase that we hope to start in February. Likely transit workers, people who are working in subways and buses, likely all category of first responders, certainly, I hope people who work in supermarkets, who deliver food, who work in pharmacies. I should say I hope, because that's not yet determined. I certainly hope that educators, teachers are in that phase. Again, not yet determined. Another category which we have not had timing updates on is people who are incarcerated and correction officers as well, who are clearly in a high-risk congregate setting. I'm advocating for that to be done as soon as possible. In the case of people who are incarcerated and correction officers, I would actually like to see that happen now before 1B. Again, so that's 1B, which we expect to start according to the city's current timeline in February. Phase 1C is more broad collection of essential workers and people who are 65 and older and people with underlying conditions. How are underlying conditions defined? Well, that's also to be determined. And I know you have many questions about that, which we want to answer. Unfortunately, that phase is not set to start until March or April. And then finally, kind of the open general population phase, someone like myself, and probably many of you, is not, according to the city's current schedule, not set for until the summer. We need to speed this up. That's why we need more resources on the ground disseminating vaccinations. But what I've just described are the phases and approximate timing as currently outlined by the city.
Great, Mark. And just a few more, a couple of specific follow-ups to that one. One, you did mention teachers. I believe you said it was undecided when teachers, but we have got a few questions specifically asking when teachers fall on this. If you could just add a little to that.
I will, and then I might touch on children as well, which is kind of a related question. And look, teachers are essential workers. Those that are working in person are high risk, and in my opinion, need to be vaccinated as soon as possible. We have not yet gotten word on this yet, but I'm hopeful they'll be in phase 1B, which could start as soon as February. What about young people? Well, so the vaccines that we currently have on the market have not been studied for young people. For the Pfizer vaccine, it was 16 and up, and that were in the study. And for the Moderna, I think it was a slightly younger cutoff age. I'm actually blanking on what that was, but not young children in either case. So it's just not appropriate yet to vaccinate kids because we haven't had essentially a pediatric vaccine. But we hope that will come. And there are trials underway. And but the timing of that is probably not imminent. I don't think that's weeks away. I think that's probably more like months away. If we have an expert on the chat who can correct me on that, please do. So, but what does that mean about kids? Well, really the best way we can protect kids in the meantime is from a vaccination perspective, is to get all the adults vaccinated as soon as possible so that we get to herd immunity and reduce the risk of transmission to kids. But in the meantime, again, vaccination is only for people who are 16 and over.
Great, Mark. And just a quick question on specifically for college students, but also a lot of other people. Does someone need to be a resident of the state to be vaccinated here? If someone who's not a resident of New York is living in New York City, are they still eligible to get the vaccination here?
So at the moment, again, it's based on people who work in certain sectors. Hospitals, doctors' offices, dentist offices, home healthcare workers, nursing homes. And so it actually doesn't matter where you live. It matters whether you work in one of these facilities in the city. And so, you know, we're certainly vaccinating a lot of people in this current phase who don't live in New York City. But you know, from my perspective, if you're working in a hospital in New York City, you deserve to be vaccinated. No questions asked. I mean, that's obvious. But it does remind us that, you know, when we think about the 52,000 people who were vaccinated in the last 7 days in New York City, those aren't all New York City residents. And so we're even less far along to, I'm sorry about the noise, guys. We're even less far along relative to the 8.5 million people who live in New York City. Now, I think it is perhaps an open question when we get to the next phase, where, for example, someone based on their age qualifies. And I don't actually know the answer to whether there'll be a residency requirement. I presume there will, but I don't know if that's yet been determined.
Great, thank you, council member. As you just mentioned, these are people in this first group are getting their vaccinations through employers. Can employers mandate people get vaccinations?
That's an excellent question. So the short-term answer is no. First of all, these vaccines, they only got an emergency use authorization. They haven't even gotten full permanent authorization. So I don't even think you can legally mandate that someone get a vaccine that hasn't had full authorization. Secondly, I think from a practical matter, you can't mandate someone to get a vaccine if there's still a shortage, because that wouldn't be fair. So at this point, there's no mandatory vaccination. And as a result, the vaccination rates in hospitals have been, I'm afraid to say, folks, lower than I think any of us would have hoped. In a public hospital system, they've reported that about 30% of eligible workers have elected not to get the vaccine yet. It seems to be higher than that amongst support staff. And a few hospitals anecdotally are reporting overall refusal rates of even higher. So that is just a sobering reminder of the challenge that we have to overcome vaccine reluctance, which we can talk more about. But look, there are people who have some darn good reasons to be skeptical of the American medical system because of generations of racism and neglect towards people of color, specifically towards Black Americans, and in fact around vaccination in some notorious instances. So we have to acknowledge that there are reasons that people would be reluctant, and we're encountering that at this phase. And I think the way to overcome that is by education, by acknowledging the legitimate concerns people have about the American medical system and ongoing racism in American medicine. I am optimistic that I think the more time that goes by and the more people see that side effects have been limited, that people will have greater confidence. That's my hope. Let's see what happens. But I'm optimistic on that front. Please, Wen.
Great. As you've mentioned, home healthcare workers are in 1A, and we're getting a few questions about undocumented health home care workers. Do they have reason to be worried about going in to get a vaccination? Should they?
Great question. And it does not matter your documentation status. It doesn't matter your citizenship. It doesn't matter whether you have health insurance, and your ability to pay is also not relevant. If you qualify for a vaccine, you will get it, and your data will be protected. It will not be shared with immigration authorities under any circumstances. In fact, you will not even be asked about your immigration status. And again, there's no cost to the public for this. And there's some scams that might tell you otherwise, which maybe we'll get into, but there's no cost to you for the vaccine. If you have an insurance card, you'll present it, the insurance will pay. If you don't have insurance, then the provider will cover it. Again, no cost to you. And there are some undocumented people who qualify in this phase. And they are going to need to present, you do need some documentation to show that you're indeed employed in the given sector. That could come in the form of a pay stub, in the form of a letter from your employer, or in the form of an ID. But even that requirement will not be in place for some of the broader groups based on age, based on medical condition. And remember that in New York City, anyone can get an ID, a municipal ID, without regard to documentation status. I realize I don't have mine in my pocket because it's in the other room, but I mean, that's actually not required for vaccination, I believe, at this point or at any point, but always a helpful reminder that you can get a legal government ID here in New York City, whether you have, and actually now in New York State, forgive me, at the New York State level as well, whether you have documentation or not. Please win.
Great. We have a question from Melissa Schiffman. She wants to know, when will we know which underlying health risks are included in Group 1C, and who's making these decisions on how to categorize these different health risks?
This is a critical question which we need an answer on now. Partly for the peace of mind of people in fact impacted, and partly so that we can plan as a city to roll this out and not do everything last minute. So there's a body that's part of the CDC. It's the ACIP, I think the American Council for Immunization Policy, which is setting these guidelines. And we actually have something of a star in the vaccine world here in New York City. A deputy commissioner in the Department of Health, Jane Zucker, who is our vaccination czar inside the Department of Health, who's on the ACIP. So we really have a direct line into there and feel good about it. And the state and city have both signaled that they will broadly follow their instructions, although we do have some leeway. But when it comes to New York, we're really relied on the state for vaccination priority. So all these questions I've talked about, when will 75-year-olds be qualified, et cetera, what kinds of essential workers will qualify, that is, the state has power there. So we're asking the state to clarify this. And Melissa, I think we need these answers immediately, even if it's not starting right away. Tell us who's in this category and how we define underlying conditions so that we can plan, so that patients can plan, so the city can plan. And if we need to accelerate capacity to move that up, that will certainly bring that into focus. When I saw one question that is a topic that I am passionate about, which I'm just going to throw in, which is, so I'm sorry I didn't see who asked it. I'm sorry I'm not giving you credit, but someone asked, how is it that we did so well in 1947 and we're struggling in 2021? So we had a very scary smallpox outbreak in April 1947. And we had this amazing visionary health commissioner at the time, a guy by the name of Israel Weinstein, who grew up in a tenement on the Lower East Side, the son of immigrants. And he launched what I think can be considered a wartime effort that got 6 million New York City residents vaccinated in 23 days with hundreds of vaccination sites, which were operating 24/7. And these were in, I mean, every kind of government building and even some non-government buildings, from fire stations to schools to union halls, and they did it. Now, COVID vaccination is a little bit tougher, I'll grant, but we needed an effort of similar intensity, and actually the health department of today has a plan in place to respond to bioterror attacks. This is a plan that was created after 9/11, and for example, it provides for responding to an anthrax attack by getting antibiotics to the entire population of New York City in 72 hours. And that would happen under this plan by, again, deploying thousands of workers to hundreds of sites. I think that plan mostly uses school buildings. That plan has been drilled and rehearsed. It's not just a hypothetical. Again, it's just a reminder of what we can do when we go really big, and it's what we need to do now. And I said this before, we got to be in hundreds of sites. We got to have round-the-clock facilities. We need thousands of people out there. City workers from every agency. This is something that they did in 1947. It wasn't just health department agency workers who were out there. They had people from every city agency. We should do the same now. We can. And retired medical workers and nursing students. And we need to hire more people to do this work. And I'll tell you one group of people we need to hire: out of work theater workers, people in arts and entertainment, a workforce which has been without income for 10 months. And man, these people know logistics and they don't mind working an overnight shift. So, so let's go big on the workforce too, not just in the locations. Okay, Wen, back to you.
Great. We're getting some questions about the city's plans to vaccinate homebound seniors and people with disabilities who can't make it to vaccination sites. Is there a plan in place to get that done?
Well, I'll tell you what should happen. And that is that we need to have vaccination capabilities door to door, period. There are people who can't leave their home or shouldn't leave their home. And, you know, we have an infrastructure for delivering medical services at home. Groups like the Visiting Nurse Service of New York, and there's many. We have a way to get to people's door and into their homes to provide medical care. And actually we're behind on this because at least Rhode Island, I think other places, but I've seen news reports, Rhode Island's already doing this. They're going door to door. And so we need either through one of the existing home health care services or some other method, we need to be able to vaccinate people who are homebound. Now, in terms of prioritization, I think it's understandable that we have to start with people who are working outside of the home because they have to be exposed every day. And I understand that people who are homebound because of either medical condition or age or other factors, it's also brutal, and we need to get you the vaccine as soon as possible. But again, the first priority has been people working outside the home and people residing in nursing homes. So yes, we do need to find a way to vaccinate people who are homebound. I think the broad outlines of how it would be done are as I just described. What the city has not yet publicly stated, at least, what that plan will be, and I'm certainly encouraging them to do that as soon as possible. Thank you, Wen.
Great. Mark, I'm actually going to drop the link to the New York City Vaccine Command Center so people can learn more about the phases and stuff. But do you want to talk a little bit about what the city's doing to communicate all this to the public and different sites that people can visit?
I'm sorry, I got distracted by a very cool chat, Wen.
Okay.
Someone is saying that there are jobs available as vaccine greeters through something called ABS Staffing Solutions, which might be one of the contracting agencies, which is the city's brought in to help vaccination sites. So there it is in the chat. This is great news to me. This is why we do these gatherings, because I learn from you every time. So that's great. So I apologize when I missed your last question because I was excited to see an email posted for people who want those work, that job.
No, it actually kind of fits. I was just bringing up what are the best ways for people to get information from the city on the vaccination program and all that. I'm putting the New York City Vaccination Command Center link in the chat, but if you had any other good sites or places that people should be visiting.
Sure. So the city's Department of Health has a kind of a central vaccine page that probably is what you're about to post in the chat, which has a list of locations where vaccine is taking place, details on the categories that I've been discussing about who's eligible and projections on when, and also links to scheduling for the sites. You know, I'll tell you, man, the fact that we don't have a single payer healthcare system is really hurting us now on many levels, including the number of people who don't have health insurance, but also that we have a very disjointed healthcare system. And so, unfortunately, there's not a single scheduling system. There is a link to schedule in the city's Department of Health clinics. but for scheduling at one of the independent, what I called before FQHCs, nonprofit community clinics, you have to go through them. And I expect other providers will have yet additional scheduling systems. And this is just a really unfortunate downside of a fractured healthcare system without the benefits of something like single payer.
And we just got to follow up to that. What about communicating this information to seniors and homeless folks who may not have access to the internet? Are there any outreach programs?
Well, so this has been a challenge for, I think the city has struggled with this throughout the whole pandemic, because there's a certain universe of people who are not going to see the tweets and the Facebook posts and are not going to visit the city's web pages, and frankly aren't even going to sign up for their text alerts. And so we need communication strategies that that go beyond social media, and that includes. Sorry about the noise, guys. My very cute dog, Hermione, is excited about this topic. That should include calling people on old-fashioned landlines. It should include hard copy mailings to people's home addresses, and it should be in every language spoken in the city. And we haven't always done this during this pandemic. And my goodness, the stakes are higher than ever. So the question about homeless people, I'm not sure if you were referring to people who are in the shelter system, in which case vaccination will be organized by the shelter provider, or whether you were referring to people who are unsheltered in the street. And I think that is a bigger challenge. And frankly, we're going to need street outreach teams to inform people of their options for vaccination, and frankly, potentially even to perform vaccinations in the street. Now, certainly with the Pfizer vaccine, that would not be practical because of the cold storage needs. Moderna, it might be doable, but some of the ones that are coming online have more flexibility. So I do envision the point at which we have mobile vaccination sites. The city has done this with other outbreaks, by the way, and certainly our unsheltered homeless or street homeless would be a prime candidate for that kind of service. Back to you, Wayne.
Great, thanks. And I just wanted to throw in there, we're getting so many great questions from folks on the chat. We'll not be able to get to everyone, but we will work to follow up on questions after the Zoom over the next coming day. So if we don't get to your questions, we will certainly try to answer it. You could always—
And a quick comment from Lise Brown, which I can just answer before it scrolls past. She asked, "Are we assured of getting 2 shots of the same vaccine whenever that happens?" Yes. All providers are committed to that. And so you will be scheduled for a second vaccine by the provider that provides you the first one, and you will get the same one that you got at your first shot. Sorry, Wayne, please.
Not a problem. Not a problem. We've got a question from Fern Hertzberg and Maria Lizardo. They are interested in your opinion about prioritizing human service personnel for the vaccines.
Well, my goodness, Fern and Maria, I love it when esteemed leaders join these conversations. I mean, two of the best nonprofit social service leaders we have in Uptown Manhattan. Thank you for raising this point. Absolutely. Human service workers are essential workers, and they have been working throughout this pandemic. They have been taking risks, and their work is more important than ever because we as a city are struggling more than ever with every manner of challenge, social, emotional challenges, health challenges, the challenges of poverty, and lack of housing, and more. So the work that human service workers are doing is more important than ever. And they absolutely should be considered essential workers. So Fern and Maria, you have my commitment to push to prioritize this sector. and we can connect online about this offline if you'd like. But I thank you for bringing this up, and I thank you for leading two great organizations that are so critical to the health of our Uptown community during this difficult time.
Great. And just a little broader question for you. With things, the administration's changing down in Washington on the January 20th, do you think the change in our federal leadership will allow things to speed up and improve our ability to vaccinate New York City?
Absolutely, on many fronts. First of all, we're going to have science-based policy, and scientists leading policymaking in the White House, and now thankfully in the U.S. Senate majority as well. And I just can't stress what a dramatic difference that's going to make. The messaging is going to be dramatically different. You will see things like universal mask mandates, and you will see much clearer guidance to local governments about how to manage this pandemic, guidelines on shutdowns and safety precautions. You will see more resources put into this fight for rollout of the vaccinations. Frankly, the federal government has done nothing to help us administer vaccines. Thankfully, the research and development and manufacture has gone better than we expected. But producing the vaccine doesn't stop the pandemic unless you get it into people's arms. I mean, there are a whole host of protection measures that we need the federal government to do the right thing on. We don't control flights coming in and out of LaGuardia and JFK. That's a federal agency. And there's just been far too lax rules about requiring a negative test before people get on flights, for example. And then there's the question of economic relief, which might not have been exactly what this person was asking, but it's certainly connected. And the stimulus support, the direct relief to workers, to small businesses, to the entertainment industry, to the restaurant industry, to state governments and local governments has been woefully insufficient because of Republican resistance. The main roadblock being the Republican majority in the state Senate, and that majority is about to go bye-bye. Thank you, Reverend Warnock and John Ossoff. We kind of lost that great piece of news in the dramatic developments yesterday, but Democrats are taking control of the Senate. New York City's own Chuck Schumer is going to be the majority leader. And boy, does it feel good to say that Mitch McConnell will be the minority leader once again. So I'll be fighting for much more robust economic assistance in terms of $2,000 checks to people who are struggling, direct assistance to restaurants, direct assistance to the entertainment industry, struggling arts institutions, and more. So yes, this is a big deal. It can't happen soon enough. Even waiting 2 more weeks is too long, but thankfully help is on the way.
Great. As we talked briefly before about these pop-up sites for vaccinations, will the healthcare workers who are staffing these vaccination sites be considered healthcare workers and then be able to get into the 1A status?
Yes, it was just determined that anyone working in a vaccination site is now part of phase 1A. And that also includes non-medical staff, by the way. So if you are a person who is checking in people to come for their vaccine or helping to manage the line in front of the facility, you're now considered a healthcare worker. And just like as I mentioned earlier, a medical receptionist in a doctor's office who may not themselves be providing clinical care is now considered a part of the healthcare sector and is eligible for Sector 1A. So I see some questions about how hard Uptown Manhattan has gotten hit in this crisis, which has truly been heartbreaking for all of us who live here, who have had so many of our friends and neighbors and loved ones who've been impacted. And while it's true that Manhattan as a whole has not fared as badly as other boroughs in the city, the loss borough-wide has been devastating. We've lost thousands of Manhattanites, and in particular, the loss in Uptown Manhattan has been serious. And the challenge here continues with higher infection rates than other parts of Manhattan. Thankfully, we are seeing infection rates in Uptown Manhattan that are lower than many parts of the outer boroughs, and we're grateful for that. But one infection is one too many. And there are a variety of reasons for this. The profound inequality that underlies this pandemic, in which essential workers who are more likely to be low-wage workers, people of color, immigrants have been out there in this pandemic getting sick, and disproportionately our community is home to those heroic essential workers. We know that overcrowded housing conditions drive this pandemic, and we have very crowded apartments in Uptown Manhattan. And we know that access to healthcare over years and decades has led to conditions that have driven inequality. And unfortunately, we have far too many families in Uptown Manhattan, especially those who are undocumented, who don't have access to healthcare. And we better make darn sure that in the vaccination program, we address this inequity. And I'm fighting extremely hard for this, to make sure that when we define essential workers, we include the low wage sectors that I have described, to ensure that as we roll out vaccination sites, that we're in the places where COVID victims are concentrated. And that certainly includes Uptown Manhattan, to make sure that our messaging and our outreach is targeted to the communities that have been left behind in this pandemic, to help overcome justifiable vaccine hesitancy in communities of color, and particularly the African-American community. We need an effort on that front comparable to what we did in the census, when we spent tens of millions of dollars to contract with community-based groups to be out there as ambassadors so people would participate in the census. And largely it worked. We beat other big cities in this difficult year. We need something at least at that scale to promote understanding of vaccines. But this is a multi-pronged effort, and I'm fighting with all my strength to ensure equity is central to the plan for Uptown Manhattan, for the South Bronx, for Central Brooklyn, for the neighborhoods that have been left behind, for Corona, Queens, and elsewhere throughout this pandemic.
So we've got, to follow up on that, we have been getting some questions about what, as a city councilor, you can do. I know, working with you, that you have started the process to introduce some legislation that could help this. People are wondering, what can the city council actually do to help this out, and what are some of the bills that you've been working on?
Absolutely. Thank you. So we're pushing legislation, and we're also doing an oversight hearing on Tuesday of next week, which we invite all of you to participate in. We are going to have testimony under oath from the Department of Health, the leadership of the public hospitals, and this is going to be streamed live. It's a virtual hearing, of course. 10 a.m., I believe, is the start time on Tuesday. We'll be posting the link to stream it, and members of the public also are invited to testify. And so I encourage everyone to take part in the hearing again Tuesday. We're also drafting now 4 bills. One would mandate that there is at least one 24/7 vaccine site in every zip code in New York City. Secondly, we have a bill that would immediately activate our city's medical reserve corps to be deployed in these sites. Now, the city has expressed its intentions to do so in the last couple of days, which is great news. Hasn't happened yet, so we're going to continue to push the bill. We also want a vehicle for regular New Yorkers to volunteer for non-technical, non-medical positions that I've mentioned. And so we have a bill that would require the city to create a volunteer portal and a training program for people who want to testify. And then the 4th bill is to require public reporting on a regular basis of the number of vaccine sites, their location, the number of vaccines performed, and a variety of other details like the demographics of the people who have been vaccinated. So we want transparency as well. And I think I mentioned on a bill that I'm partnering with, which my colleague Keith Powers, council member from Lower Manhattan, downtown East Side, he's the lead sponsor on, and I'm co-prime with him, which would require the city to develop an alert system so that you can personally sign up and get a personal alert back when your eligibility group comes online. So that's 5 pieces of legislation that I'm leading on or helping to lead on. Stay tuned. We're going to be fighting very hard on this front.
Great. So we all know that the rollout has been pretty slow, but we are getting several questions about why was it so slow, and people wanting to just understand a little bit what were the problems and what led us to the point we're at right now.
There's no excuse for the slow pace of the rollout, period. As I mentioned before, we have ample precedent in New York City history for massive response in a shorter period of time. We have a plan already in place in New York City for rapid response in the case of a bioterrorism attack. This should be treated with the urgency of a bioterrorism attack. But if you're asking kind of practically what has happened and what are the ongoing challenges, I would say, hospitals have faced logistical challenges in doing this with staff that we must concede is under siege right now. They're dealing with a second COVID wave that's already severe enough that hospitals are having to pull back on some elective procedures. And so this has been a challenge for some of the hospitals to execute from a staffing and logistics perspective. We have been too slow to roll out sites outside of hospitals in places like high school gyms, the public housing community centers, senior centers, and places like that. Until now, vaccination has largely taken place during business hours, which is just unacceptable. There's been very little vaccination in evenings or weekends, and essentially none on Christmas and New Year's. I mean, maybe 100 and change in the whole city, and that's just not how this can happen. This has to be a round-the-clock, 24/7 undertaking. And I'll tell you what, I know that all of you, if it required going to a vaccination site at 1 a.m. or 3 a.m., that you'd do it. And I'll go even a step further. I bet many of you who are thinking of working or volunteering at a vaccination site would go to such a site at 1 a.m. to help out. So the will is there, the demand is there. We have to do it. I mentioned earlier the challenge and how, just one more thing, Len, on why this is going so slow. The challenge and how we're defining who's eligible, and we need more flexibility. Right now, if a vaccine site has some extra time slots in their scheduling system available or some extra doses available on a given day, they can't give them to someone who's not currently in the defined group, mostly of healthcare workers. They can't give it to a 75-year-old who is just who's waiting and desperate, and that just doesn't make any sense. We have to do better than that. We need more flexibility so that we never leave one scheduling time slot or one dose unused. And lastly, I mentioned before, vaccine reluctance is real out there, and many thousands of healthcare workers have refused so far, and that certainly impedes our efforts as well. Please win.
Great, Mark. We'll do one last quick question and then a wrap-up question for you. People are asking about pharmacies, specifically CVS and Walgreens. Are they administering vaccinations now? And what's their status?
Yes. So they are administering the nursing home program nationally. This is a federal program. And so they are going to nursing homes and they're going room to room, which is good for the patients. They're going room to room. Now that rollout has been way too slow. And I should have mentioned that as one of the causes for the slow pace in New York City. That's a federal program, has to be sped up. But I think the question was more about what about vaccination in pharmacies? Ultimately, we need to vaccinate every place that you can get a flu shot. You should be able to get a COVID vaccine everywhere you get a flu vaccine. That includes your neighborhood doctor's office. That should include a pharmacy as well. Now, in the case of Walgreens and CVS, they're not yet doing it in their stores. And we hope that in the next couple of weeks they will. And that some of the mid-sized chains, kind of a rung below them, like Rite Aid, would also be in that phase. I'm really pushing to allow independent pharmacies to vaccinate as well, because again, it's an equity issue. They're more prevalent in neighborhoods, more low income, more diverse neighborhoods. So we want the independent pharmacies as part of this. But I do want to remind you that just because Walgreens and CVS start vaccinating out of their stores in a couple of weeks, that won't change who's eligible. We hope at that time we'll add some additional groups, but there'll still probably be real restrictions on who can sign up. And I presume you'll have to either register online and then show up for an appointment, or come to the appointment with some documentation that you qualify for whatever the relevant priority group is.
Great. Well, we're coming to the end of the hour here. We know a lot of people still have a lot of questions, and we will again try to follow up with a lot of these unanswered ones. We know, Mark, the next couple of weeks are going to be critical in this fight. Do you have any kind of last thoughts for us here as we move into this critical phase?
Well, this has been an excellent discussion, and I wish we had more time. We'll be doing many, many more of these. That's a promise. I enjoy these conversations and learned so much from you, and you had outstanding questions. And I know we didn't get to most of them. I started by saying we're in a two-front war, and it's a war to speed up vaccination so that we are in more locations at more hours with an army of people out there doing this work, and that we get more flexibility and a faster pace in adding eligibility groups. But we have a second front in this war, which is the war against the ongoing spread of COVID in our city, which is still spreading at an alarming rate, actually an increasing an alarming rate. 5,000 new cases a day we're averaging in New York City. 3,000 people hospitalized with COVID tonight in New York City. A positivity rate citywide, which is over 9%. And most painfully of all, we're losing 40 or 50 people a day in New York City, our loved ones that we're losing to this disease every single day. And vaccination, well, the way we're going to stop this pandemic ultimately is not the solution in the immediate term. We need to take precautions, to wash our hands and wear our masks, yes, but even more than that, to really limit our movement outside of the home to anything that's not essential, especially if you're at high risk, or if you have a high risk person in your life who you might unwittingly expose. So please, everybody, while we're fighting to get vaccinated and to push this program to be more rapidly rolled out, let's continue to stay safe. We're gonna have a tough month or two ahead of us, no matter what. But you have my commitment to be there for all of you, to be there for you as a source of information, and to be fighting for the right policy at every moment, no matter who I have to take on at any level, state, city, or federal. I will. I'll be speaking on behalf of science-based COVID response, on behalf of equity, on behalf of good management, and expressing a sense of urgency. So that's my commitment to you. And I want to thank all of you again for joining us. And I'm sorry we have to wrap up now, but thank you, everybody. Be safe out there, and look forward to speaking with all of you again soon. Thanks so much.